Good evening, everyone. My name is Doug Cassidy. I'm one of the chief residents at Mass General, and I'm here to discuss our work with the translation of a virtual reality endoscopy curriculum to a live porcine model. So this work was supported by a 2019 SAGES General Research Grant. The funding source had no role in the design or the collection, analysis, and interpretation of the data, and our individual disclosures are listed below, none of which had an impact on the study. So the Fundamentals of Endoscopic Surgery, or FES program, designed by SAGES, is an educational and assessment tool of knowledge and skill in the flexible gastrointestinal endoscopy. Beginning in 2018, all surgical residents are required to pass the FES exam to graduate. Thus, there's a need for effective curriculum to prepare for this exam. The urgency for an effective curriculum has also been heightened by work that demonstrated poor baseline pass rates of surgical trainees. So fortunately, a few proficiency-based curricula have been developed to help better prepare trainees for the manual skills portion of the exam. Prior work at our institution showed that the 3D Systems GI Mentor endoscopic simulator tasks can discriminate between experienced endoscopists who can pass the FES exam and inexperienced endoscopists who cannot. Through this data, we were able to establish proficiency benchmarks and subsequently an endoscopy curriculum leading to higher FES pass rates at our institution. The ultimate goal of the FES curriculum and endoscopic training is to prepare surgeons to perform endoscopy in patients, and thus understanding the optimal VR training paradigm for endoscopy in a live animal model is relevant to all general surgery training programs. The purpose of this study was twofold. The first was to evaluate the transfer of VR endoscopy training to porcine endoscopy, and then to compare the relative effectiveness of two different VR training paradigms, a proficiency-based and a repetition-based training program. Novice endoscopists who completed fewer than 10 colonoscopies were recruited from a single large academic surgical residency over 2 academic years. Participants completed baseline demographic surveys and were provided with one-on-one familiarization sessions with the simulator by an experienced operator. All participants underwent pre-testing by completing both the FES manual skills exam and then performing a porcine endoscopy and colonoscopy assessed by the Global Assessment of GI Endoscopic Skills, or GAGES, scoring system, a validated measurement tool for technical skills in flexible endoscopy. Participants were then randomized in modified match pair design to one of 2 VR curricula, the proficiency-based training or repetition-based training. The proficiency group completed the practice GI Mentor VR tasks until 2 consecutive expert-level performances were achieved, whereas the repetition group completed the same tasks but in a set number of repetitions regardless of benchmark performance. All the participants then underwent post-tests consisting of a repeat FES exam as well as repeat endoscopy and colonoscopy with a GAGES assessment once again scored by an expert endoscopist who was blinded to the curriculum group that the participants were assigned to. During this period, there were 2 dropouts, 1 from each arm, and 4 participants, 2 in each arm, who are currently pending final FES testing. All in all, 11 inexperienced endoscopists were randomized into each curricular group. There were no significant differences in demographics between the groups, including sex, age, glove size, handedness, or prior clinical endoscopy experience. There's also no difference in pre-testing between FES scores and GAGES performance. The repetition group spent on average 42% more time on the VR simulator compared to the proficiency group, including 64% more time on the endoscopic navigation task and 57% more time on the advanced mucosal evaluation task. There's no difference in time spent on the completion of the upper endoscopy modules or the colonoscopy modules. There was a significant difference in porcine endoscopy and colonoscopy performance as measured by GAGES before and after curriculum completion. However, there is no difference in post-test performance between the proficiency and repetition groups. Likewise, there is a significant difference in FES performance before and after curriculum completion. However, there is no difference again seen in the performance between the proficiency and repetition groups, despite the repetition group having 43% more time on the training simulator. Likewise, there's no difference in performance between the 2 curricula on a subset analysis of each component of the FES exam. All participants in both groups, in both the repetition and the proficiency groups, had 100% FES manual skills pass rate. In summary, participation in a VR curriculum leads to both improved FES performance as well as improved clinical performance for novice endoscopists. A VR curriculum and training program can provide a structured approach for residents to acquire endoscopic skills in preparation not only for the FES exam, but for their clinical endoscopy rotation. While there's no difference in performance in the post-training FES skills or the live endoscopy between the proficiency and repetition-based training groups, there was a significant difference in the time spent completing the curriculum. While our study was likely underpowered to detect any difference between these two, there was a difference in training time. It was 42% shorter for the proficiency group. So in the setting of limited simulator access and time pressures on residents, proficiency-based curriculum could ensure that residents complete an appropriate curriculum in a timely manner. We'd like to thank SAGES for awarding us this research grant and providing funding for the project, and thank Karl Storz Endoscopy for their generous support and equipment donation. And finally, we'd like to thank the Knight Surgical Research Lab, in particular Michael Duggan, for their support and their care of the animals. Thank you for your time. I'm happy to answer any questions.